Good morning. This is Richard Haskell here in Dallas, Texas. I noticed recently that you've gone to the internet to select the very best possible health insurance plan for you and your family. Congratulations on doing that. But is the internet the only source that you should use in designing, selecting, and picking a plan that will meet your family's needs now and in the future? Now, you notice I said in the future. We're coming into a brand new era for health insurance. President Obama, with all of the political capital that he's amassed, is going to be able very shortly to pass a new national health insurance plan. We don't know exactly the form it's going to take. We don't know if private insurance companies are going to be able to coordinate their business right alongside the new federal plan. A lot of questions remain unanswered. So it's extremely important when you pick a health insurance plan today to pick those companies that are directly involved now with our new president in designing the new national plan. More than likely, then, the private plan that you own will fit and mesh with the national plan, and you won't have that grinding of gears that's so common when national changes are made with regard to basic services like health insurance. Now, it's also extremely important that whatever agent and company you select listen to you very carefully, that they're not trying to sell you a product, but they're listening very carefully to what you and your family actually want to happen. Some families have very small children and they have to take their children to the doctor a lot. So they want a very low copay, a $20 or $30 copay, so that those kids can go in for immunizations, preventive care, all of the things that a new mother wants to have happen for her children on a regular and consistent basis. And therefore, a copay is an excellent plan to have. Now, many insurance companies charge $150 or $200 a month more in order to get a copay. Others are very friendly to offering copays at very attractive prices. You have to know, or more importantly, your agent has to know which company is going to accomplish that objective for you. The other thing, and probably one of the most important things to look for when buying a health insurance plan, is the rate year guarantee. Some companies offer a 3-month rate guarantee, some 6 months, some 1 year, but there's only one company in America that offers a 3-year rate guarantee. Now, why is that important? If you understand how insurance companies presently work, you might start out with a $300 or $400 monthly premium if your plan is properly designed and you're with companies that are actually wanting to acquire a business and are going to be competitive in their offers to you in terms of premium. But what they'll do is a bait and switch, meaning after about a year, you're going to see that your rate will go up maybe 12 to 15%, and you'll get accustomed to it, much like a frog gets accustomed to being boiled in water when the temperature just rises up a tiny little bit. Pretty soon, he's a cooked frog. And that's what insurance companies have used over the last 50 years to deceive people into thinking that they've got a really great product, lots of benefits at low prices, and then as 2 or 3 years go by, they look at their bill in the mail, or nowadays they just draft it out of your checking account, and they see, my God, what was costing me $350, $400 a month is now $800 or $900 a month, and you might very well have to drop your policy at the time in your life when you need it the most. Are high deductible plans and health savings accounts the way to go? For some families, yes. If you need to have a large tax deduction and you're the owner of a small business, absolutely, a health savings account is the best way to go. How does a health savings account work? Which is the best place to open up a health savings account? Will the insurance company have one built into the product that it's offering me, or will I be able to go out and pick a health savings account from a bank that offers them at the very highest possible yield? There are many things that you need to know in designing wisely your health insurance plan. I'm Richard Haskell. I've been doing this. I've been buying health insurance and sharing concepts with others for nearly 3 decades. I'm coming up to my 30th year in the health insurance business. I've bought policies for my families. Obviously, I have tens of thousands of customers. I've made a lot of mistakes in choices that I've made, both as a salesman of these products, a professional guiding people into these products, or even as a consumer myself. But those mistakes were made early in my career. I've learned from those mistakes. You know, folks, it's not the fact that you make wrong choices. It's the fact that you continue to repeat wrong choices. There are many, many ways that a health insurance buy can be bad. Number one, is it a company that you're looking at now that has the lowest price on the internet? Are they going to have the lowest price 3 years from now? Do they offer a rate guarantee? Are they working to design their new plans to coincide with what likely might come out of Congress and the new Obama administration in the near future? Are the folks who are designing my plans right now, are they big enough? And are they bad enough to have a seat at the table when Obama finally signs new health insurance legislation, so that the plans that come out are a wonderful public-private partnership that result in the very best possible result for the American family? And you are the American family. I'm speaking to the American family. There are 40 million uninsured. What will happen when all these people start jamming into the doctor's offices with the new Obama National Health Plan? Am I better off just joining that herd of 40 million people, or should I preserve, protect, and defend my right to own my own individual plan in coordination with the Obama plan, so that I can continue to see the very best doctors and go to the very best hospitals without having to wait in line for 6 months or a year in order to get that vital operation that I need? Is a copay plan the best way to go? Is a health savings account the best way to go? Should I have a prescription card, or am I better off just lowering my premium and paying for my prescriptions out of my own pocket? Should I have dental insurance to go along with the plan? These are the questions that I can help you answer. And let me share with you one very important thing. 90% of what I do is listen to what you tell me. I want to learn about you and your family and how you have related to health insurance purchases in the past. I want to know why you're in the marketplace. I want to know something about your health conditions. And under privacy laws, it'll be like talking to a priest. Everything is totally confidential, so that I can carefully design a plan that's going to cover all of your pre-existing conditions from day one. I want to talk to you about all of the limited benefit plans that are out there that look good on paper because they have such low premiums, but end up being nothing more than a glorified insurance discount card. I'm going to give you a very important phone number. It's my mobile number, 469-569-8209. Congratulations on making the choice. You know, you can go to the internet and learn everything you can possibly learn about a medical condition. For example, diabetes. You can learn everything that there needs to be learned about that. But only a doctor who's been practicing and working with tens of thousands of diabetic patients, it has the wisdom. It's important to have knowledge about price, deductibles, and benefits. But what's even more important is to have the wisdom to be able to design the plan like a master builder would design a home. You wouldn't purchase a $500,000 home from somebody who just graduated from construction school. You'd go to a builder who's been around and stayed in business for 30 years, and you'd want to interview the people he's sold homes for to see if they're satisfied. I can offer all of that to you if you'll consider listening. If you will allow me to listen to what your needs and objectives are, and then we will design a plan around your needs and objectives and help you avoid all of the common mistakes that are made when purchasing a health insurance plan strictly on the internet and looking strictly for the lowest possible price. Health insurance now is a very delicate proposition, and you have to have an agent who can guide you through, help you make decisions that are going to be reflective of the needs and objectives of your particular family. I respectfully submit I'm that professional. Again, my mobile phone number is 469-569-8209. Call it right now. You'll be glad that you did.